introduce our speaker. Her name is Cap Wilkes. You all know Cap, and she is our Senior Program Coordinator here at Rural Health Innovations. And so I'm going to turn it over to you, Cap.
Great, thanks, Angie. Well, hello, everybody, and welcome to our webinar today. We are going to be talking about evaluation plans and writing down and some of the components that go into an evaluation plan. To get us started, I would like to just really do a roll call, make sure that everyone's sound is working, because on these webinars it really is nice to have an opportunity to have people chime in with their thoughts and questions. So in Todd, over to your right, where you're adding your name and stage and your network project. I think most everybody's done that, but this will give folks time to catch up. Let's start at the top with Cheryl. And Cheryl, if you could just kind of do a hello check-in, and we'll make sure we can hear your voice. Star 2 to unmute. Another way to unmute yourself is if you start 2 to unmute, then you can probably use your phone mute button. Makes it a little bit easier going forward. But Cheryl Jones from Alabama, can we have a hello from you today? We're not able to hear you, Cheryl, so if you could give it a try, star 2 to unmute. And Janice, we're going to be asking you for a hello next, if you could give that a whirl.
Hi, this is Janice.
Hey, Janice, thanks. I can hear you loud and clear. And for folks using this pod going down, you can scroll down on your own. Marcia, you want to give a hello? Star 2 for hello. Marcia's typing. How about Tori Betcher and Chase Allen in Indiana? Can I hear your hello?
Hi, it's Tori and Chase at Aspen.
Hello.
Hi there. Thanks for joining us today. Good to hear your voices.
You as well.
Hey, Abby. How about a hello? Great.
I'm here. Ashley's not able to call in, I don't think, so.
Okay. Well, that sounds good. Cindy, are you nearby? Cindy Large from Indiana. Star 2 to unmute if you're able. How about Sindra out in Montana? Star 2 to unmute.
Good afternoon. This is Sindra from Bozeman, Montana.
Great. Can hear you loud and clear, Sindra. Thanks. And Ashley from Kentucky. Ashley's online, and Marcia's online too, but not able to call in. All right. Well, if you're able to, Ashley, get on the phone. That would be great to hear your voice. And Suzanne Smith, I see you're logged into Adobe, but not have your name over there on the right yet. All right. Someone said they're not able to unmute, so that might be Ashley. Let's see. Suzanne, Cheryl. We didn't hear from Cheryl yet. She might be her quiet one. All right. Oh, Cheryl's typing good. All right, Suzanne. Wonderful. I see you're logged in the way on the right. If you can join in by sound with your phone, that would be great. But glad you're all here. Thank you guys for taking the time out to be with us for this webinar today. I'm going to go ahead and change to our webinar presentation page.
Hi, Cab. This is Stephanie with the HCC Collaborative.
Oh, great.
I'm actually on the phone in the car, but I am participating.
Okay, good. Well, thanks for letting us know you're close by.
Hi, and Cap, this is Beth Ann Carter. I'm not able to log in. I'm just calling in.
Okay.
Program coordinator in Montana.
Great. Thank you, guys, for letting me know you're on the phone. And if you do have questions, I know I'll try to say out loud what people are looking at, but if you do have questions, just chime on in.
Hi, Cap. It's Ashley in Kentucky.
Oh, good. Hi, Ashley. Thanks for joining the phone, too.
You're welcome.
Okay. Well, on the presentation page, what we have going on the lower left is a couple of documents, and they're available for you to click on and to download. So when you click on those, you'll get an option to download, and then you, there's one other little pop-up that you have to answer, and then the document will go straight onto your own computer. One of them is a guide, which is really what we're going to talk through today. And then the template is it's a Word document that you'll be able to actually fill in if you all don't have an evaluation plan to use already. This would be one that would be great for you to use. So let's go ahead and get started talking about evaluation planning. You know, we want to introduce you to this toolkit. We developed these resources for rural health networks and specifically your training program. And you do have this evaluation plan as one of your deliverables at the end of March this year. We wanted to provide you with something that would help you out. We know that many of you have either a lot of experience in doing evaluation planning, evaluation work, or perhaps you're contracting with an evaluator to do your program evaluation. So this template might not be needed for you, but walking through the parts will help you look for those items in your own evaluation plan. And then if you haven't done an evaluation before, or you're looking for some a template or a framework to use, we're hoping that this evaluation plan will be helpful for you. I do have a quick poll for those of you that are able to fill it out. And Angie, I just created this. I'm just going to add it right up to it just a sec. No, I don't see it. There it is. All right, I just put this poll up on the screen. I'm going to put it right in the middle. You guys go ahead and answer your familiarity with doing some evaluation planning. Maybe you're very familiar, somewhat familiar, and you really haven't done evaluation planning before. Take a look at what we've got going on. All right, so 8 of you have answered, and 4 of you said you're somewhat familiar with evaluation planning. 1 of you are very familiar, so I'm going to ask that person to be ready to chime in if you've got some tips or some other ways of approaching your evaluation plan as I walk through the guide. Actually, that's an open invitation to everybody. And then there's 3 of you that are less familiar with evaluation planning. So I hope that I can answer some of your questions and give you some guidance along the way. I'm going to hide this poll. So this is our center's purpose page, and I like to start here because it helps you, helps me to give you a chance to understand really where we're coming from when we are presenting our resources. You all know me pretty well. I've got an MBA and have a lot of different work experience across many types of organizations, large ones and small ones, and retail and nonprofit, and I've worked in rural health networks before here in northern Minnesota. And we support over 100 rural health networks across the country with the different programs that we provide TA to. I also have experience doing some teaching. So I have working as an adjunct faculty in college here in Duluth, Minnesota. And I have experience doing some of this online teaching through our webinars and through that adjunct work. Sometimes I've done straight didactic teaching, kind of like this, where you're lecturing and you're providing knowledge and insights through a webinar or a PowerPoint kinds of presentations. Also include with Adobe Connect opportunities for interaction and polling and conversation. And I've also used online teaching formats like Moodle or Blackboard, that kind of a thing. And some of you all are using something called a hybrid approach, or at least a how it's referenced sometimes, where it's a combination of remote didactic learning and then sometimes in-person learning when you gather the students together. And then on that, with your all program, in addition to the clinical time where folks spend time on site in a clinical setting practicing their work. So that's kind of experience I come from for creating these tools for you. And then also from our network TA where we have created this evaluation writing and planning efforts for the development grantees, which are slightly more, well, they've been around the block as networks, and we used that evaluation toolkit for them last year. And in providing them with support and technical assistance, we really learned a lot about how health networks use their evaluation plans, and in our learning have really, I think, improved this toolkit. So we're looking forward to providing this to you today. Do you have any questions so far about the evaluation toolkit or comments? All right. So the objectives for us today are to really help you understand the components of an evaluation plan as you're thinking through how to write one, and to provide some clarity on the purpose and approach of evaluation, give you an understanding of the difference of measuring outputs and outcomes, or in other words, the tracking of implementation progress and the monitoring and demonstrating of impact or results. And also the methods of collecting and reporting results. We have some a tool that we'd like to provide to you or suggest. And then lastly, the importance of the communication plan and our intention in sharing those results, and a way of thinking through that communication plan. The general or overarching reason for program evaluation really is to be systemic about collecting information, or systematic is the better way of saying that, for collecting information about program activities and objectives, monitoring that progress, and reporting and communicating results. So we want to spend some time considering aspects that specific components for evaluating a program. And we're really suggesting that spending time in the planning phase of evaluation really does save time in the long run. And here are the components we're going to be talking through today. We think that there's a program description component. It's important for setting the context for the evaluation plan. It includes things like the program mission and vision and goals, listing those objectives, history of the program, and the members that are participating in the program. The evaluation design is meant to provide a description of really the purpose or the reasons for even doing evaluation. This helps external leaders really understand what they're going to expect to see throughout the evaluation plan. And then there's a section about how do we measure key data. So we have to be planful about what we're measuring, selecting these really key data points that illustrate progress and show outcome. And then there's a section about actually collecting that data and figuring out how to report it. We want to gather and collect the program progress and impact in a way that's easy, again, for the external leader to follow through with the thinking that goes into that evaluation plan. And then lastly, this aspect of communicating the results. We want to be both intentionally and purposeful about sharing our results with members, maybe potential new members, communities, and funders. So this is getting at showing the value and success of the program. As we get started talking about an evaluation plan, we have some terminology we want to make sure that we are sharing and have some understanding as we work together on the development of the plan. Many organizations use different language to talk about evaluation. So what I'm going to share with you is what we've built into this evaluation guide. And the key for you really is to be consistent in your language. So if you are using different words to describe your evaluation components, that's totally fine. But we wanted to be clear with you what was built into this guide so you can go from there. So a planning framework is really how you approach planning. And there's basically two different perspectives. And you guys have bumped into them both, at least the two that we're going to be talking about on this side. One of them is what we think of as pre-traditional strategic planning. And what strategic planning approach does is identify the path of action towards the goal. So these are the objectives, which are strategies that will lead to successfully reaching a goal. And a strategic planning approach, if you think about it, really on a document, starts at the far left of the document and works towards the right. So it talks about here's the goal, here's the strategy, here's the measures or targets we're going to be aiming for, and the aligned initiatives. The other planning framework is a logic model. A logic model approach identifies the expected result. That is, if the objectives are really the outcomes of the program that will illustrate that progress toward the goal. And a logic model approach starts, if you're looking at a document, on the right side of the document with the impact and the outcome, the result. And then you work towards the left and build out the intermediate or midterm outcomes back to the initiatives, which are actions and the activities and outputs that get you there. So our suggestion is to be clear which planning framework you're using and then stick with it. But along this line of talking about terminology, generally program goals are articulated within a grant application, and they really do remain constant during the life of the program, the grant project. These goals are what the program is aiming for, and in strategic planning language are often called the mission or vision, where they use the word goal to describe those long-term impacts of the program. The overall objective of the evaluation results is to demonstrate really incrementally the positive change towards these program goals, if you refer to them as goals or impact. The trick is simply to be consistent in which language you're using. For example, a program goal might be improving access to health care. Then for program objectives, these are the strategies or the outcomes for the achievement of the program. Language at the end is different based on the framework that you're using. In strategic planning lingo, objectives are actually strategies that describe the high-level path that will lead to the program goal. For example, creating a coordinated care process. These are strategic objectives are measured in order to monitor progress towards your program goals. For the logic model framework, those objectives are referred to as outcomes, and they describe the expected success of the activities. For example, the coordinated care process is completed. Another area that we want to make sure to address overall during evaluation planning is to consider using SMART objectives. We all have heard this acronym before: specific, measurable, attainable, realistic, and timely. This really is a key to a successfully evaluated program because it allows you to actually measure your progress. We even suggest that if you're looking at your goals in your grant, your objectives in your grant, and they're really broad, such as everyone is healthy, it might be, we think it's really worth the time and effort to rewrite that objective and make it a SMART one. So an example would be health outcomes of patients in our community with diabetes improved within 3 years. And this gives you something that is specific, measurable, attainable, realistic, and timely. another aspect of evaluation that we really wanted to highlight here because we think it's so important. None of these things that we plan for in our program is a standalone planning event. So this strategic planning cycle illustrates that the strategic planning is interrelated with your evaluation planning. What we're highlighting here is the aspect of monitoring and adapting within your strategic planning cycle. So this really is what your evaluation plan does. So you should be happy to know that as you're writing your strategic plan, the evaluation plan fits right into a section of that larger strategic cycle. Oh, thanks, Marsha. You're saying that you're not able to hear me very well. I'm going to switch something up for just a sec. All right, this is Cap again. How does that sound? Is that better? Much better, yay. Then I'm going to stick with this one. Great. And just in time for the real meat of the presentation today. So here are the components of program evaluation. And I've listed through these: program description, evaluation design, plan to measure key data, collecting and reporting results, and communication plan of key results. We're going to go through the description. So for those of you that have downloaded the evaluation plan guide, we are now on page 2, I believe. No, around page 5. So page 5 will get you straight to the program description section, and you can follow along if you'd like. So the program description provides context for the evaluation plan and really sets the stage for the reader. We suggest that you're writing your evaluation plan for external readers. Your board of directors have a responsibility actually to hold the program accountable for achieving their goals. And having an evaluation plan for them that is easy to read and helps them understand the work of the program is really vital for them to be able to do their job. Others are also interested in how you're evaluating their program, and also to watch as the progress is made. So if you're writing your evaluation plan for external readers, it really helps you set the context and allows you to be articulate about your program history, the value propositions, that is the services that you're providing, what you're trying to achieve, and who those program members are. Specifically for the program members, what you're looking for in describing is how they are either receiving value or how they're contributing to the program itself. One of the nice things about the program description is that it can be developed for multiple ones of your multiple different planning documents to be able to use program description. On page 6 of your guide, we're working through the evaluation design. And in that design, we have the opportunity to describe the purpose and reason for writing an evaluation plan. You're asking the question, why is evaluation important for this program? The design itself, in the narrative that you create for the evaluation design really doesn't need to be more than a page. But what it does is it focuses on what planning framework you're using. And in this way, again, you help set context for your external reader so they know what they're reading and the rationale behind the use of language that you've selected. It's often quite nice for your readers to see a diagram that illustrates the alignment of your goals, your objectives, and your activities. We'll be creating a sample document. It wasn't ready enough for us to present today. We wanted to make sure to get all our I's dotted and T's crossed. So the sample document will be available in the coming couple weeks. And what it will provide is something what we mean by a diagram that illustrates this alignment. The third section of an evaluation plan is actually a plan to measure key data. And in that plan, there's really 3 components. You need to decide what you're going to measure, when you're going to measure it, and who's going to be responsible for collecting that data. So you're really planning your evaluation in this section, and illustrating it in a chart is very helpful to your readers. It's a way of them to really track what's important and how you're going to go about measuring that data. In the what section in particular, where it's really important to select the data to measure that's going to illustrate progress. So it's progress of your implementation in the form of output, or progress towards your impact, and that's really measuring your objectives. It's absolutely key to identify very specific targets and to define that measurement. So if you're talking about hitting a benchmark, for example, within 10%, that might be your specific target, but the definition needs to be 10% of which benchmark, and how are you actually going to calculate that? For example, what's the population you're going to draw from? And that means which population are you not going to draw from? So is it just a particular subset of population, or is it during a particular time frame that you'll be gathering that data? It's also important in this section of your plan to actually decide how to collect the data. Having timing for collecting your data is important for keeping people on track, and who's going to be responsible is, for those of you with experience in evaluation planning know that it's hard to carve out the time to collect this data and update your charts. And so having someone feel responsible and being held accountable to that duty is a key success factor in evaluation plan work. So let's talk a little bit about what data is really key. It's important to ask questions when you're doing your evaluation planning, and one of the really important questions is what progress has actually been made toward the program activities or the implementation of your project. So this data is often referred to as outputs. It's the outputs generated by the activities that are getting completed towards your project. So that's what we're talking about in this particular slide. Strategic planning language, when we're tracking activities, we're really counting. So activity results are typically counted as they're identified as what's occurred. For example, if your objective is to start up a school or primary care task force, then tracking your activity may be how many times did your task force meet that year. A tip here is that the key data for tracking progress really isn't everything off of your work plan. In fact, having your work plan is important. Having a work plan is important. It helps you keep progress and activities done. But in your evaluation plan, the key is to track those things that are really quite large in scope, so maybe 6 or even 12-month initiatives. Try to figure out what you need to measure that shows progress that are really critical to the success of your program. Limiting your key data for tracking implementation is important because your external reader is going to get way bogged down in the details and will not be able to stay engaged with your work if there's just too many things to be tracked. So the other aspect of data is monitoring your impact. And the question here that we're asking is toward program objectives. If you're using strategic planning language, you're talking about how are we making progress towards our strategy? If you're using the framework language of logic model, you're asking what progress is made towards our short or midterm outcomes. So this data is referred to oftentimes as either achievement toward
Cap, we've lost you. You keep cutting in and out.
Okay, I can hear you.
We hear you and then we don't hear you. It's in and out, in and out.
All right, I'm going to dial in again. Folks can be patient. Hang on just a sec. Hello, this is Cap again.
That's good. We can hear you.
Great. All right. I will keep going. I am going to just back up a little bit on this key data monitoring impact page to make sure that that you heard everything that needs to be said on this one. So in monitoring impact, really the big question that we are keying in on is what progress has been made toward program objectives. And objectives, which are those strategies, and in logic model, which are the outcomes. So when we refer to the data, it's often referred to as what have we achieved so far along the strategic path, or what are the outcomes reached, what are the results of these outcomes that we have placed before us. And oftentimes the measuring is the result of the effort. So for example, perhaps we are trying to measure an outcome of improved health. And if the population we're working with are a specific population with diabetes, we're looking for an improvement based off of last year or last quarter, or perhaps we're basing it off of an increased improvement off of a benchmark that has been created for it. So we are looking for measurements that we can track the result of our good work. Now this is very difficult to do, and we encourage you to work at it and continue to find those measures that are really key for measuring the progress that you're making that impact the outcome or the achievement. And really you don't need very many key measurements here to show results. Look for one or two that really tell the story about the work that you're doing. So these outcome measures do not show up as activities from your work plan, for example. Measuring impact isn't about how many times the task force met or even how many students were graduated. Those are those are tracking activities. The number of things in the event. What you really like to do for measuring impact is how much did those students learn, for example. And it may be a grade, but it could be their self-assessment of what they've learned and how and the ways that they are anticipating applying that learning. Some of the data gathering options could be surveys and questionnaires where you're looking for satisfaction or attitudes. Maybe is actually, as in this example, some lab results or quality measurement changes. If you access long enough time, morbidity rates or access, because access to healthcare, for example, because you have work in the workforce will result in healthy first and satisfaction of employment related to things like retention. It seems like you can the pause here, and if there's any questions or even thoughts or comments that people would like to share about when you're doing evaluation planning, how do you approach the difference between tracking activities and monitoring your impact? Are there folks out there that have had some success in differentiating those types of measurements? Could start to unmute would be great. I know there's one of you at least that has a lot of experience with evaluation. Well, later on I'm going to ask a simpler question. So if you guys are sitting on some thoughts, you'll get another chance in a little bit. What we have in the next few slides are some examples, and you'll see these again in your guide. I'm on page 9 of the guide now. We're really still in the section where we're planning how to measure key data. And we're emphasizing this particular area component of your evaluation guide because it really is so important to the success of your evaluation efforts. We need to plan what to measure, and when we're planning them, we need to decide really on those key measurements that are going to show progress towards our activities and also for help us monitor our impact. This particular chart has goal 1 at the top, and for each of the goals, you're going to have 1 or 2 objectives. These are either your strategies or your outcomes that you're aiming for. And then in the what section, we're talking about what is that measurement, what are you aiming for a target, how are you going to define that measurement, and that's really the description of the calculation itself. One thing that we found in my organization is that it's very difficult to remember how you're going to measure, and we often have to go back to our plan to see exactly what population we're measuring, who we're including or not including in that calculation, what's the time frame, that kind of a thing. And then also the method for collecting that data, because in many cases when you find something that you're trying to collect data on, you actually need to figure out how to collect it too. There's a plan or a process in place for collecting data effectively. Perhaps it's a survey that you need to write or a benchmark you need to find that's not so easy, and it takes some effort in figuring out how you're going to collect your data. And then lastly, it's always important to identify the frequency of that collection process and then who's responsible. And like I said earlier, easy to not fill out your evaluation plan, so having someone responsible for it with dedicated time is really key to success. So this takes us to this component, collecting and reporting results. So this is where you take that plan that you've just been working on and you continue to develop the analysis of that work. So this is the chart that allows you to collect and display the results. again, you have goal 1 at the top, and then program objectives, strategic objectives, or your outcome. And the very same measure description, it could be literally taken straight from your plan of evaluation chart right into this one. And you have the measure and the target and the frequency. And this is where the document starts changing, is you actually put in the results. And this allows you to track over quarters and annually. Now for your own evaluation planning, you could be doing monthly, quarterly, annually, and maybe you want to even include a trend analysis in this document. The real key here is to think about those external readers. And in your evaluation plan, you want to make it easy for them to see your progress. Sometimes I've seen evaluation plans that break their collection and reporting results into outputs or process or activity tracking, and then they'll have a different page for those objectives that they're tracking that from impact or outcome orientation. So it's up to you and your program how you want to identify the measurements, process or activities measurements of your implementation, or the outcome and objective measurements that monitor that impact. We've provided here this chart as a really basic way of approaching a collection and reporting. Sometimes we use the language scorecard. You'll hear people mention the use of the word scorecard. A scorecard really is a chart of collected and reported results. Oftentimes the added insight to a scorecard is using colors to show progress. So would be really hitting the benchmark target that was intended. A yellow color would be used to visually highlight the areas that you're slightly whatever percent that for your program would be reasonable. Probably think of it as able to catch up given some changed circumstances. And then using red to really highlight those objective measures that, and we'd like to spend some time being ready to articulate what we're going to do about those measures that we are behind on. I'm going to so we have some time to talk a little bit if there's some suggestions from folks who are on the call today. So this communication plan of key results is the last section of an evaluation plan. And the reason we include it, and we really are serious about including this piece, because how you communicate the results really is important for, in a way, the beginnings of or an aspect of your marketing plan. Because as you really pick the key measures, maybe there's only 3, 4, or 5 of them out of your entire evaluation plan that you want to highlight to, again, external readers so that they can see quickly what is going well and what are you struggling with in this particular program. We have made the suggestion that you want to identify the measure and who the audience of the communication is going to, the mode of delivering that information, how often it's being delivered, and again, who's responsible for that communication. Examples for this may be that you have an impact or a result, outcome result that you want to communicate to the community. It might be that in your program you're impacting the number of workforce and therefore increasing accessibility to a particular service or healthcare opportunity. And so the audience is community members, and maybe by direction you're using media and your website perhaps you've got a newsletter that you distribute to healthcare organizations in your community, and that you're going to do this frequency, and the person responsible is an individual in your organization, or perhaps it's a contracted individual that you use to really have a strong visual display of the results that you're trying to communicate. So this communication plan is really key, and it's something worthy of spending your time and effort on to make sure that the people around you know what story your program is telling and the impact you're having in the world. Because if you get down to it, the reason we all work so hard is to change the world a little bit, and in doing that, we want people to know about it so that they can be a part of that story. So those are the components of an evaluation plan and our suggestions for how to write one. We really want to encourage you to consider all of these components in whatever evaluation plan format and layout that you're considering. So if there's any of these sections that you are less familiar with, perhaps we can help you with those. Either if you have questions now, we can talk about them, or you can contact us directly. We're happy to read through any of your draft evaluation plans and provide coaching up front. We'll also be spending some time in our TA calls in April and May following the submission of your evaluation plans and providing some input to you on those as well. So I'm going to open it up to some questions. We'd love to hear from folks on how they're doing your evaluation plan is coming along, or perhaps a tip or a suggestion on any one of those component areas that we talked about today. So start to unmute. I know many of you have that opportunity. It was great to hear your voices at the beginning. So let's see if there's any questions here or that you could add. I'm going to go to the wrap-up page as well, because we do like to get your input, and I want to make sure to give some time to announce some upcoming events. So the very top poll is how satisfied are you with this webinar, and what we'd like to really get your input on is if the content is going to be helpful to you as you write your evaluation plans. And I'll highlight that we have some upcoming PA. We have a peer group call on February 10th, and we'll be talking about your evaluation plans and how they're coming along, and get some opportunity to share some progress on that, on your efforts. And we have PA check-in calls coming up in March, as well as a webinar on the 16th of March. We'll be sending out some information on that to focus on student recruitment and through outreach. Today's topic for future work. Please give us called Toolkit you all are thinking about to learn.
Kath, this is Angie. You're really cutting out again. Kind of have been throughout the second half as well, but not hearing you again.
Well, why don't we have Angie, you wrap us up then, and I'll use the chat box.
Okay, perfect. So I think Kath had asked if any of you would be willing to share maybe some of your knowledge or what you've done in evaluation planning, those of you who participated in that poll question. Is there anyone who would be willing to unmute their phone line and talk to us a little bit about your familiarity with evaluation planning? It'd also be a great way for us to check and see if it's Kath's connection or if it's it's maybe a goofy open voice connection that we're having for the webinar. I'd love to hear someone's voice. Anyone? No one wants to share anything about their evaluation plan? You can press *2 to unmute your phone line. Looks like Ashley's typing something. If someone's willing to share with us anything about their evaluation plan via the chat box, that would work too. Yeah, and Marcia's asking if someone could just speak so that we know that our connection is working.
This is Stephanie Taylor with the HCC. I mean, I've heard CAP just fine pretty much. I've been in the car though, so it was a little noisy from the road noise, but it was good information. We actually work with an outside evaluator on all our grants, and that's a huge help because we work with someone who's pretty much an expertise in that field, but it is good to meet with them, I think, ahead of time. Because if they're really good, they'll really challenge you on, how is this measurable? Because sometimes when you just want to up and go and do a program, you don't always have that big picture of if it's really going to work, if you're really going to get the outcome. So just having kind of those outside point of views saying, okay, well, that sounds great, but how are you going to measure that? Gwen's been great for us as an organization, just to help us develop those for the most part. Other than that, I don't have a ton of experience with evaluation.
Okay. Thank you, Stephanie. And we heard you just fine, so that's positive.